So for the purpose of this video, because of time constraints, we're just going to do range of motion exercises once instead of 5 times. Hi, my name's Erica. I'm going to be your nurse today. We're going to do a complete head-to-toe assessment, okay?
Okay.
Okay, what's your name?
Melanie Peters,
And how old are you?
23,
And when were you born?
December 3rd, 1993.
Okay, and where are you at right now?
Cape Breton University.
Okay, awesome. So first, can I see your hands? Great. Temperature feels good. Now I'm just going to check your capillary refill. Looks good. So I'm just going to take a look at your scalp. Any tenderness?
No.
No bumps? Awesome. Okay, so now I'm just going to check your temporal artery. Awesome. Okay. Can I get you to open your mouth wide? Can you go side to side? And close. And clench. Okay, awesome. Check your sinuses. Any discomfort? No. Okay, awesome. Now we're going to take a look at your eyes, okay? So first, I need you to hold this card up to your eye. Okay. And I want you to let me know when you see my fingers, okay?
Now?
Awesome.
Now? Now.
Awesome. Okay, do you want to switch eyes for me?
Okay. Now? Now? Now.
Awesome. Okay. I'm just going to hold this card. I want you to stare at my nose, okay?
Okay.
Okay, that's great. Okay. So now, I'm just going to take a look at your pupils. It's going to be bright, okay? Awesome. Okay, so now I want you to follow my finger, okay?
Okay.
Great. Awesome. Now I want you to follow my finger as I bring it inwards, okay?
Okay.
Awesome. I'm just gonna pull your eyelids down a little bit. Okay, looks clear, moist, and up. Okay, clear, moist. Awesome. Okay. So now I'm just gonna take a look at your ears. Tell me if you feel any tenderness, okay? Tenderness? No. Now I'm going to whisper some words to you, and I need you to repeat them back to me, okay? Oh, and yeah, can you cover your tragus? Yeah, just push them in here on the opposite side.
Monday. Tuesday. Baseball.
Awesome. And switch fingers. Cover the other ear. Yep.
Monday. Friday. Basketball.
Awesome. Okay. Now we're going to take a. You're going to see your nose. Okay. Can you cover your nostril? Yep. Breathe in through it. And out. Any trouble breathing?
No.
Okay. And the other one? And out. Any trouble breathing? No. Okay. Great. So now, can you open your mouth for me? Okay. Your tonsils look great. Can you lift your tongue? Awesome. Okay. Can you stick your tongue out? Okay. Now I do have to make you gag, okay? So can you stick out your tongue? And can you say ah? Right. Thank you. Okay. So can you give me a big smile? And can now you frown? And can you smile without your teeth? Okay, perfect. So I'm just going to check out your neck, okay? Let me know if there's any tender spots. No bumps. Okay. I'm just going to check out your cervical nodes. You can just drop your chin a little tiny bit. Okay. Just going to feel your trachea. Okay. Nice and defined. Great. So now I need you to take a gulp of this and swallow when I tell you to, okay? Okay, swallow. Great. Can you take another gulp? Gulp. Yep. Awesome. Thank you. Now we're just going to do some range of motion exercises with your head and your neck. Okay, so can you bend your head forward? Yep. And backwards. Awesome. Side to side. Inside. And tilt your head. Other side. Awesome. Okay, so now we're going to do it with some resistance. Oh, actually, can I get you to rotate your head? Yep. Awesome. Okay, now we're going to do it with a little bit of resistance, okay? So push your head forward. Okay. And backwards. Awesome. Sideways. Yep. And to the other side. And towards you. Awesome. One more time. Awesome. Okay. So now I'm just going to take a look at your back, okay? Can you take off your shirt for me? I'm just going to get you to turn a little bit here, okay? Yeah, that's perfect. Yeah. Yeah, okay. Okay, so your shoulders are symmetrical. Awesome. I'm just going to feel your spine, okay? Tenderness? No. Oh. Okay. I need you to take a deep breath, okay? In and out. Can you do that one more time for me? Okay, great. Okay, so every time I place my hands on your back, I need you to say the word 99, okay?
Okay. 99. 99. 99, 99, 99.
Great. Awesome. Now I'm just going to take a listen, okay? Okay, so every time that I place the stethoscope on your back, I need you to take a deep breath. That's in it good. Okay, so now I'm just going to do some light tapping on your back, okay? Okay, awesome. Yeah, okay, so. Okay, now I'm just gonna look at the front of your chest. Awesome. Just take a deep breath like before, okay? Awesome. Okay. So same thing as before. When I place my hands on your chest, I need you to say 99. Okay.
99, 99, 99, 99, 99.
Okay. Awesome. Just gonna feel around. Let me know if you feel any discomfort. Okay. No tenderness? No. I'm just going to listen to some breath sounds again, okay? Okay. Deep breath. Deep breath again. Great. Deep breath. Deep breath. Deep breath. Deep breath. Okay, awesome. Okay, so now I'm just going to listen to some heart sounds, okay? Yeah, can I get this to turn a little bit? Yeah. Awesome, great. Okay, so did you want to? Oh, actually, that's fine. Okay, so I'm just gonna take a look at your arms. Tell me if you feel any tenderness. Okay. Okay. No tenderness? No. I'm just gonna get your brachial pulse, okay? Radial pulse. Okay. On this side, please. Go ahead. Okay, now we're going to do.
So this part of the video is going to be demonstrating the evaluation of your deep tendon reflexes. You want to make sure that when you're checking reflexes that the patient is relaxed but that the tendon is on some kind of stretch, otherwise you won't get a reflex from it. So we want to make sure that we test them in both upper and lower extremities, and we test them bilaterally. So we're going to start with the upper extremity and the biceps reflex. So this is a reflex on the biceps tendon. And what we want to do for this one is, again, the patient's arm is to be sort of relaxed in the patient's lap. And I'm going to put pressure on the biceps tendon in order to stretch it a little bit. And then I'm going to strike the tendon with the reflex hammer on my own finger. I should be able to feel the reflex in my hand, even if I can't see it in the muscle contracting. Alrighty. Again, for that one, you could see the arm jumping, but I could also feel the reflex myself. When you're doing the reflex, make sure that it's a quick, rapid, it's not a flunk down and hold it, it's a quick, rapid tap. So we'll do that again. And again, we want to make sure that we do that bilaterally. All right. So we also want to be able to do the triceps reflex. For the triceps reflex, again, we need the arm to be relaxed, but the tendon to also be under some stretch. So we need the arm to be bent. So generally we will hold the patient's arm out to the side and have their arm bent. And let me hold as much of the weight as I can. Okay. And again, strike the triceps tendon with the reflex hammer directly. And again, you notice a slight swinging of the arm out laterally when that's struck. And again, make sure you do the same thing on both sides. And so just relax the weight into my hand. And you notice the slight jerk of the arm outward. So finally, we're going to do the patellar reflex and the Achilles reflex in the lower extremity. So for this one here, make sure you find the patellar tendon and just relax your leg as best as you can. And the same thing on the other side. So this patient has good brisk reflexes. They're not hyperreflexic, but they're easy to see. Some individuals' reflexes are much more subtle than that and a little harder to see. Finally, we want to do the Achilles reflex. If I let the leg dangle like this, the Achilles tendon is relaxed and not under any stretch. So you want to push up on the foot so that the tendon is stretched. And it's generally easier to strike it with the back of a hammer, but you can strike it with the front. So again, just relax as best as you can. And then the same thing on the other side. Try that one more time. All right. So the next reflex we want to do is the plantar response reflex, which is also referred to as the Babinski. So what you're going to have the patient do is, if you could move back on the table a little bit for me, and I'm going to pull out the footrest. And so you want to do this is you're going to run an object relatively firmly across the dorsal aspect, the plantar aspect of the foot. And you want to make sure you use something clean and new each time so that you're not, again, transferring things back and forth between patients, because this is a relatively firm pressure. So we generally use a new tongue blade for that. What you're going to do is on the sole of the foot, you're going to run the tongue blade up the side and towards the midline. You want to do it relatively quickly and with decent pressure. This isn't a tickling motion. You want it to be relatively firm. And you want to watch for the direction that the toes curl. All right. So I'm just going to run this tongue blade across the bottom of your foot. Now you notice it was a subtle motion, but his toes curled towards the plantar surface of the foot. So toes down going is the normal response. If when I did that motion his toes pointed upwards, that would be upward going toes or an abnormal response to the Babinski.